left PI ilium. So this ilium has gone PI with a little rotation, okay? So we want to, of course, I like to use a motion palpation, and we want to be able to assess the pelvis and determine the listing. So if it's a left PI ilium, we're going to place the first block at the left greater trochanter. We're going to place the second pelvic block at the right ASIS. Okay? You can use muscle testing if you feel comfortable with it. You can actually feel, you have your hands on the person, and with the pelvis and the low back, you can just feel the body relax. Now, you can actually, there's a whole other thing with supine pelvic blocking, which I may or may not have time to get into, probably won't. But supine pelvic blocking is great too, but you can use muscle testing to be able to see if the body responds to where the blocks are. Remember Emily, my patient that I started with, and she just couldn't even lay face down? I'm like, what are we doing with this lady, right? I have to do everything supine. So I have to do the blocking supine, I have to do all the adjustments supine, I have to do everything supine. So you can use muscle testing when they're prone to be able to see if they're in the correct position, okay? You want to only really keep them there for about 1 to 3 minutes, okay? If you go past 4, 5, 6, going into that realm, what ends up happening sometimes is it can actually make it worse because now the body's guarding, right? So we don't want that. So does that make sense to everybody, right? So can I get a hands up if that makes sense to everybody? Yes. So you can adjust the rest of the spine while the patient's on the blocks. I always joke that if I wasn't a chiropractor, I would have been like an emergency room doctor. If you come to my class tomorrow, you'll hear all my story about I was meant to go to medical school. My parents wanted me to go to medical school. That was my path. That was where I was gonna go. And I like, a lot of different things, right? So I would have been an emergency room doctor, right? So I like to have many things going on at once. That's just how my brain works. So I can put this person on blocks for 1 to 3 minutes, and then I can go to the next room. And that's how I work. But you can work with one person at a time. In my practice when I was practicing it, with lots of people, I'd have 4 or 5 people on blocks at the time. So I'm just kind of going into, you just kind of get into the zone and into the flow, right? And you just get really good at it, and you really, really zone in. So you can become a master of this, right? So they're on the blocks though only for 1 to 3 minutes. You really don't want to put them on there for much longer than that. And then you can also adjust the rest of the spine while they're on the blocks. So even if all you ever did was blocking, that is considered an adjustment. Okay, so if you use insurance, all you ever did was block the person, you never adjust them anywhere else, that's considered an adjustment, and you can actually bill insurance for that if you needed to, right? Obviously you want to check your state, your insurance carrier, all of that. Now, let's just say the person's got an interpelvic tilt, right? So their pelvis has gone completely forward. They've got a double ASIS listing, okay? So I love blocks for this because, especially, remember our pregnant moms? They all have that lordosis. A lot of our postpartum moms, they're still stuck in that lordosis, right? Some of our women that have endometriosis, fibroids, ovarian cysts, they have that increased lordosis because of that added weight, right? So I love this, and for a long time when I started my practice, I started very bare bones, so I didn't have a lot. I didn't have a lot, right? Because I was I have all this debt, student loan debt. I'm not gonna buy more things, right? So I didn't have a traction table. I didn't have a decompression table. Was beyond what I thought I could ever afford at that point. Some of us who are doctors, you remember what that was like, right? Way back in the day. And, or maybe for some of you it's happening right now. And so I love this for the anterior pelvic tilt because it's not as good as traction, it's not decompressing, but it does take that pressure off of the L5-S1. Does that make sense? Can I get a little round of applause if that makes sense?